My name is Judith John, and I am very fortunate. I have wonderful friends, a fantastic family, a loving husband, and 2 great daughters. I've also been privileged in my career. I've headed up communications for 2 major hospitals in Ontario. But it hasn't been all smooth sailing. Since 1999, I've been fighting for my life. I've had 5 surgeries, 2 for cancer, 3 for brain tumor. And I've had terrifying moments 3 times that I was sure I was going to die. But I didn't waste time wondering why me. So I rewrote my will, and I spent hours writing emotional letters to my 2 daughters because I was sure I would miss all the key moments in their lives. And I wanted them to know my hopes and dreams for their future. Today, the cancer is gone, but the brain tumor is a lot more loyal. It keeps regrowing. Plus, it's inoperable, and it's in a dangerous location. It's pressing on my optic nerve, giving me double vision, and it's wrapped around my carotid arteries, which means I'm a stroke waiting to happen. Every single day, I deal with relentless chronic pain, which is very lonely, very isolating, and at the end of the day, truly exhausting. I also cope with double vision. You may have thought these glasses were a fashion statement, but actually the lens is covered up so that I don't walk into walls. My future, my last hope, is gamma knife radiation. It will not remove the tumor, it will not take away the pain, but it will prevent the tumor from regrowing and causing more damage. I know this tumor has shortened my life, but I live with gratitude. I am a serial optimist. I know I have been blessed with outstanding health care, and because of that, I've had the opportunity to see my daughters develop into smart, wonderful women. In fact, they threw away those letters. They wouldn't read them because they're confident I'm not only here now, I'm going to be here for all the milestones in their life. I've tried very hard not to let my health define me. Of course, fears do come, especially at night. I do my best to keep my pain and my panic at bay, but I'm not always successful. And every time I walk into the hospital and put on my blue hospital gown, which is the common denominator, that's when I'm at my most vulnerable. That's why every greeting or not, every time you talk to me as an individual or not, every single interaction is crucial, and those interactions are critical to my care. I once had a marvelous conversation with a nurse, and I was explaining to her that in fact the double vision in fireworks season isn't such a bad thing. I just take off these glasses and I see twice the fireworks without having to resort to LSD or drugs. And guess what? The next morning I found a card from her on my bedside table, and it was the fireworks display. And at the time, I was struck by the extraordinary kindness. This was a healthcare worker who had connected to me as a person, not just a patient, who had taken time to find the appropriate card to leave me a message of support. It was so meaningful. And even now, I have that card and I look at it to remind me of what a difference one person's act of kindness can make. It made me feel better. I have absolute faith in my clinical team. They're the bricks of wonderful health care. But the mortar around those bricks and between those bricks can be uneven and cracked. And those bricks can actually build silos where people don't talk to each other and don't connect. So while the brain surgery is impressive, the basic human interaction and communications can actually be alienating. Waiting in the waiting room. Now, I always go expecting to wait in the waiting room. It's not called a waiting room for nothing. But to wait 5 hours after your appointed time in a room where no one has come from behind the glass to explain what happened, to apologize, to acknowledge the time, to actually treat you like a person is very, very frustrating. I've had to fight with a healthcare worker to get my own MRI so that I could take it to a doctor. This was not a shining moment for both of us. And the ongoing series of administrative snafus can be so discouraging. Having to argue with someone as I was trying to set up a follow-up appointment because I said I'd had surgery, she said I'd only had an MRI, and I had the 48 stitches to prove that I did have surgery. It was a bizarre conversation. But perhaps the biggest failure when trying to connect with the healthcare workers comes when you're asking a question. And to a person, the clinician is too busy, too brusque, too absorbed in something else, and too distracted. It's routine for you. But you fail to remember, it's my first time. It's my brain, and it's my real fear. We absolutely rely on the technical skills and the medical knowledge and the expertise that happens within the walls of these healthcare settings. But what we're looking for is the simple stuff. It's based on simple human kindness. Acknowledge us. Ask what we need. Be present for us. Acknowledge our fears and help us get over them just by talking to us. It takes remembering that the patient is a person even though he or she may wear a hospital gown. It doesn't take much, but it means the world of difference. That simple act of communications is vital to us as patients. It's a lifeline. It's the line between abject fear and a sense of confidence. So make those moments count. Create some fireworks moments with your patient. Connect with us. We'll be better partners in our own care.